Choose Country. Discover the rural practice pathway to a health career in WA.
When the chance for us to move to Albany came up, I was just ecstatic. The Rural Clinical School provides me with an opportunity to be with the students for a whole year at a time, and they are learning in a way that's really meaningful to me. It's embedded in community, it's embedded in practice. I work as a physician at the hospital, and in that role I help run the palliative care service, the oncology service. I do some geriatrics and I do a little bit of general medicine cover. My patients and the staff that I work with now have state-of-the-art facilities, brand new cancer centre, CT scan facilities, MRI will be arriving shortly. The difference between working in the country and working in the city have been immense, but have been a fantastic change for me for two main reasons. The first is that I have much closer contact with my patients and families. When I was working in the city, I was working in a relatively big hospital. The practice that I have now is so much more diverse. I get to see people with all different types of illnesses, but also at all different stages of their illness. So that connection with patients has just been great, really good for me intellectually, a real breath of fresh air for my career, to have that sense that the people you look after are getting better, they're going back into their families, into their work, into their communities, and they thank you for that. I think the other thing for me has been working much more closely with my colleagues. We band together, we support one another, and in fact I have never worked with physicians of the quality that I'm working with now. So I haven't actually felt that my practice is more stressful. I haven't felt that my practice is isolating. In fact, it's been completely the opposite. I have a great work-life balance. I'm able to work it so I've got plenty of time for my hobbies, the needs of my family. I garden, I do yoga, I bushwalk, I kayak. It is different from the city, but the things that I think perhaps we get told about country practice, they're not the negatives. They've actually got this really positive spin on them, and then that's what I found working in the country.
Choose Country. Discover the rural practice pathway to a health career in WA.